Welcome back to Namibia Connect. Thank you for still staying tuned. Now, cancer is no longer a silent crisis in Africa, but a growing public health emergency that requires urgent, equitable, and sustained action, according to the World Health Organization. World Cancer Day is observed annually on February 4th to raise global awareness about cancer prevention, detection, and treatment. Rolf Hansen, the Chief Executive Officer of the Cancer Association of Namibia, joins us in studio. Good morning, and thank you so much for joining us on Namibia Connect.
Good morning, and thank you for the opportunity.
Wonderful. Now let's talk about the latest statistics on cancer incidence and mortality in Namibia, and how do they reflect on the World Health Organization's view of cancer as a growing crisis in Africa?
So currently we have about 4,100 new cancer diagnoses reported to the registry at the Cancer Association annually. We do appreciate that because we're not getting all the data, we are understating by about 17%. And when we translate that data into an age-standardized rate, and that means basically we do the calculation to benchmark with other countries across the world, and we say per 100,000. So for every 100,000 Namibians, there's an X amount of people being diagnosed. And when we take those rates, actually, we see that Namibia has one of the highest cancer incidences in Africa. Our breast cancer incidence rate is the highest, prostate cancer is the second highest, and then our lymphomas, both men and women, are the highest. When it comes to cervical cancer, we're number 3 in Africa. So it is truly alarming, and we have a lot of work to do.
Now, what factors like lifestyle or environment contribute to this rise in cases?
I think there has been the misconception because of the old idea that you inherit cancer. So even when we talk about cervical cancer, you would have a lady that come and says, my mother had cervical cancer, and therefore I think I will get cervical cancer. So there is a lot of miscommunication, lack of understanding, and factual understanding as well that plays a role. But yes, lifestyle is a huge challenge. And I had a beautiful conversation with NBC Radio on World Cancer Day, where we tried to unpack exactly lifestyle factors that are accelerating cancer in Namibia. To break it down, we became independent in the 1990 cycle. So the whole of 1990s, we started seeing an urbanization. We started seeing a transformation where Namibia developed from our traditional farming lifestyle and quality food to a faster-paced Namibia, where we have urbanization, our people are moving into the cities. And I think many of our viewers today will also agree. You rush home, you quickly make something, or you grab takeaway, processed food, carbonated drinks, preservatives, colorants, flavorants, and our bodies can actually not adapt to it. So our immune system is highly compromised. It's working overtime to try and heal. And this plays a critical factor on our immune system and our health.
Indeed. Now, the rural patients often face a long travel to Windhoek for screening. How does the Cancer Association of Namibia address these geographical and financial barriers?
We have our patient financial assistance program, as well as our transportation program, as well as interim homes. But the reality is a centralized healthcare system of a disease of such nature is a challenge, not only for the health system, but for our patients as well. And while we have our patient financial assistance, transport, and accommodation support for our patients, the reality is no person should leave their family and their loved ones behind back in the village or in the regions. And very often it is a 6 weeks treatment journey that these patients need to go through. So we support the decentralization of cancer care, of critical care for that matter. And we're doing everything we can to work collaboratively with the health ministry to reinforce, especially for our state patients, our vulnerable patients. We have supported the Oshakati Intermediate Hospital's oncology unit. And on the 23rd of February, we are handing over a refurbished unit that is now the Walfish Bay Oncology Center to the Honorable Minister of Health. And this is our gift as Cancer Association to the Namibian people, because wow, every year when it's apple time, all of us buy apples like crazy. So we want to do these things to support what the ministry is doing and to provide and bring access to healthcare, cancer care for our people, to bring the services closer to the communities. It's a long journey, it's a costly journey, but we remain committed.
Now, speaking of bringing the services closer to the people, how can the Cancer Association of Namibia support prevention and early detection, HPV vaccination, and childhood cancer care nationwide?
I think it's critical to remember that the Ministry of Health and Social Services is the custodian. They roll out the policy, they are responsible. And not just the Cancer Association, but all of us as public, as corporates, as business community, we have a critical role to play in supporting the efforts of the Ministry of Health and Social Services. As Cancer Association, we are committed to keep on raising awareness, having these types of conversations to dispel the myths, break the stigmas, and get people to start talking about cancer. It's an uncomfortable talk. It's a scary talk, especially when we talk about HPV vaccination. The moment someone hears vaccine, red lights, alarms, distrust, misinformation, fear. And we need to get the right information out. We need to empower our women and our girl child to make the right decision. So we will continue to create awareness, to build advocacy at grassroots level so that our people in the regions can make the right decisions. Because social media has a very delicate way of sometimes confusing us if we don't have all the facts. And that is what we're committed to work with our media partners, such as NBC, to get the message to our people and that they can understand and know and then take their health in their own hands.
Great. Thank you so much. Now, just before we let you go, any final remarks perhaps for those that are watching Namibia Connect right now?
I think the most important thing is that we need to take our health into our own hands, become responsible for our health, get the right information, and that we do by asking the right questions, not just listening to what the auntie next door is saying. We need to empower ourselves. And I want to encourage even yourself. Remember that you and your daughters have a critical role to play in the future and the success of this country. Women are so beautiful and so powerful. Without you, we haven't got a foundation for the future. But before you become a patient, I want you to just be a health client. Just for the screening, for the vaccination, for the information. Because helping a client is so much better than trying to cure a patient or trying to comfort their children and loved ones if that patient dies from cancer.